Poliomyelitis, commonly known to us as polio, is described by the CDC as a disabling and life-threatening virus that can cause paralysis and even death. While over 99% of those infected with the polio virus experienced minor or flu-like symptoms or even no symptoms, less than 1% of polio has resulted in paralysis or death. Although this seems like a very small percentage, it has left hundreds of thousands of people paralyzed and dead worldwide. The earliest finding of what is believed to be polio was from an Egyptian stele anywhere from 1580 to 1350 BC that pictures a priest with a disabled and withered leg holding a cane. And this is what researchers believe identifies most with the polio virus. So while it's really hard to trace back where it started, it's been around for thousands and thousands of years. The first physician to provide a description of the illness was Dr. Michael Underwood in 1789 in England, after he observed children with disability of the lower legs. By 1840 in Germany, Dr. Jacob von Hein conducted the first real investigation into polio and came up with a theory that it was contagious. By 1916, polio had already been declared a virus and contagious. The first polio epidemic in the United States took place in New York, and this is what finally got the attention of the country and many other developed countries, as really just fear spread as thousands of patients were left in an iron lung, paralyzed, or even dead. By 1952, polio had reached its peak in the US with over 21,000 paralytic cases. The good news was, in the 50s, vaccine development was really racing ahead more than it had in the past, and socially and culturally, it was becoming increasingly popular. By 1955, Dr. Jonas Salk developed the first polio vaccine, which was an injectable inactivated polio vaccine, also known as IPV. And this is what was used for the first couple years. By 1961, Dr. Albert Sabin develops a live oral vaccine against polio, also known as OPV, and this becomes the vaccine of choice basically just due to easier administration, less need of resources and manpower. And over the next 40 years, OPV was really the preferred method of choice and was distributed worldwide, especially to underdeveloped countries, which was a huge step forward in the effort to eradicate this virus. By 1996, ACIP had recommended an increase in the use of IPV, the injectable vaccine, due to less side effects and much more effectiveness compared to OPV. And since the early 2000s, the United States and many other developed countries have only used the IPV polio vaccine. But there are lots of countries today that only use the OPV, just still due to the less need for resources. The CDC now recommends that children get 4 doses of the polio vaccine, one at 2 months, one at 4 months, one at 6 to 18 months, and one at 4 to 6 years old. When considering the nursing interventions for the polio vaccine, one of the most important is just education of new parents and community members. Many people today do not understand the severity of the disease, and especially in parents that are against vaccinations or people who don't know much about the medical field, they really might not understand the severity or details of this virus. So it's important for nurses to educate people on the history, the severity, the manifestations, and the vaccine schedule, so that it's really something that we stay on top of. Especially just the normal education about standard precautions and hygiene. I mean, washing your hands, proper disposal of tissues, cough etiquette are just really important stressors when it comes to a disease like this that is highly contagious, as it is a droplet virus. When it comes to administering the vaccine, it is intramuscular or rarely intradermal, typically in the outer thigh of younger children. So just educate parents on the side effects to watch out for, which is injection site reactions, which can be redness, swelling, pain, and then also fever, drowsiness, and body aches. It's important to stress the fact that these side effects are common and are normal as the body is developing antibodies and resistance, and that these side effects far outweigh the effects of what the polio virus can bring.